Good morning, everyone. I'm Jasper Wong from HKU. Today, I'm going to share with you some updates from our latest clinical trial for the safety and efficacy of Stent. Minimally invasive glaucoma surgeries has gained their popularity over the past decade. Stent is one of them. Stent is a subconjunctival drainage device. It is 6 mm long with a 45 micrometer internal diameter. It is made from porcine collagen and is implanted externally through a preloaded injector. Here is a short surgical video. We first inject mitomycin C 3 mm post-limbo at the supranasal quadrant and fill the anterior chamber with OVD. And then we slowly insert the injector and pierce through the sclera into the subconjunctival space. Now here you can see the tip of the injector. And then we slowly push in the stent and retract the injector carefully. At the end of surgery, we have to make sure that the stent is freely mobile under conjunctiva and not engaged to any tenon. In the past 2 years, we have been conducting a clinical trial called the Stent versus TRAP study, the XVT study, to compare the safety and effectiveness of stent implantation and trabeculectomy as a primary surgical treatment for medically uncontrolled glaucoma. The subjects are blinded to their group assignment and is a one-to-one randomization. We include patients with suboptimal IOP control despite non-surgical treatments, including SLT and topical medications. We exclude patients with previous glaucoma filtration surgeries and patients with pre-existing conjunctival scars, such as previous pterygium surgery. Outcome measurement include postoperative IOP and medication reduction at least 1 year after surgery, and success is defined as intraocular pressure less than 20 mm mercury and a more than 20% IOP reduction or more than 2 medication reduction. We further classify complete success into primary and secondary, depending on the need of additional IOP lowering office procedures within 3 months of surgery, such as needling under slit lamp or laser suture lysis. We also document complications. The major ones include persistent hypotony, wound leak or implant exposure requires surgical repair, wipe out, or even endophthalmitis. The minor one include transient hypotony or self-limiting wound leak. So far, we have done more than 60 cases, and 30 of them has already reached at least 1 year follow-up. You can see for the trabeculectomy group and the Stent group, the baseline IOP are 26.6 and 23 respectively, so they are not too much difference. And the mean IOP at 1 year time point, both groups achieve mid-teens and with no statistically significant difference. However, for the trabeculectomy group, the baseline medication is higher, reaching a 3.9 medication preoperatively. For the Stent group, it's only 2.9. However, you can see for both groups, after 1 year of the surgery, most of them still don't need any medication. And of course, for a number of medication reduction, because the baseline effect, trabeculectomy group is higher than the Stent group. Concerning the success rate, the primary complete success for both trabeculectomy group and the Stent group are at 60-something%, while the secondary complete success is higher in the trabeculectomy group at 85%, with only 66% for the Stent group. That also translates into qualified success, 92% for the trabeculectomy group, while only 73% for the Stent group. For complications, both major and minor complications in both trabeculectomy group and Stent group are only 6.7%, which is quite low. I would like to draw your attention to the need of additional IOP lowering procedures. For the trabeculectomy group is 46%, while for the Stent group is only 26%. This actually explains why the trabeculectomy group has a higher secondary complete success rate, because the surgeons tend to be more liberal to do laser suture lysis to achieve a lower intraocular pressure. Versus the Stent group, we do not have this option to achieve a lower intraocular pressure. In summary, both Stent and trabeculectomy are safe and effective subconjunctival drainage procedure for glaucoma patients, and early results in our study show similar IOP at 1 year time point, and most of them would not need any medication. Trabeculectomy seemed to offer higher overall success. However, the primary complete success rate between the two groups are actually quite similar. It could be attributed to a more aggressive approach in laser suture lysis for the trabeculectomy group. More subjects and longer follow-up time will be needed to achieve a more definitive conclusion in our study. Thank you very much for your time. I would like to take this opportunity to thank Professor Christopher Leung, Professor Jimmy Lai, Dr. Yoli Fong, and also Pullman Chang for their help and contribution to this study. Thank you very much.